My name's Mike Sullivan. I'm really happy you're watching me today. I have one of my very dear and best friends. His name is so and so. I don't want to disclose that at the time. I just want to do a video because we try to help people as much as we can. We do that certainly from a tax perspective. As many of you know, I've got 20,000 viewers. Believe it or not, 83% of you are men. So this video, I think, is going to be right on point for you because I was really touched by my friend's story here, and I think you all have to know that. So my friend went ahead and went to the doctor's office. He asked for his PSA test. And I'm going to let Mr. So-and-so, we will disclose it later. If you call me or leave a message, I will forward it on to my friend here. So we're going to remain nameless. I don't want people contacting him. So we'll go from there. So let me ask you something, Mr. So-and-so. You were about your normal business, and one day you went into a doctor's office, you got your blood test, and they said, do you want to do a PSA? What happened after that?
All right, well, I had a full physical in March. Everything was fine. Doctor said, you're like a healthy 25-year-old man. He said, there's nothing wrong with you. I could do some tests, but why? He said, just keep doing what you're doing. That'll be fine. Saw another physician for just a routine workup, and he said he wanted to do blood work, and he said, should I do a PSA? And I said, sure. You really only check PSAs once a year. Traditionally, prostate cancer is a real slow growing cancer, and you really shouldn't see much change, from one year to the next. So this was March, so 5 months later, August, I got my blood work back, and it was Friday night, and my wife was sitting beside me, and I looked down and saw that my PSA had doubled since March. And that's what you look for, in a PSA, is a jump. It's not necessarily, normal PSA is less than 4. So it's not like 3 to 4 that's scary, or 4.1. It's a jump. And I actually doubled my PSA. So my wife, I've been a cardiology PA for 28 years. I knew exactly what that meant. And I said, that means prostate cancer. So I have a urologist in my building, saw him on Saturday morning, started the ball rolling, got a MRI, got a PET scan, and was scheduled for radical prostatectomy in like a week.
What are you feeling right now internally?
Nothing. I feel great.
Nope, nothing
Zero.
different.
Zero.
Okay.
Zero. I mean, normal things that happen as we get older. Just quick anatomy lesson. The urethra is how you make your urine and expel it. The prostate is one of the 3 things that continue to grow as we get older as men. Your ears, your nose, and your prostate. Imagine that.
Pinocchio.
Yeah.
So Pinocchio was an old man.
He probably was.
Probably was.
But,
okay.
Normal urinary symptoms, when you're 18 years old, a lot more forceful than, 65. So, that was a eye-opener, for me, that this thing would have grown for another 5 years, or 5 months if I hadn't done the PSA then. So, kind of a random pickup, no symptoms, just purely a blood test. But on the biopsy, which followed up, it showed concerning things there. The thing about prostate cancer, they say what the lesions are on a scale of 10. It's called a Gleason score. And mine was a 9 out of 10 on the Gleason, which means it's very aggressive. So blessing from God that I had that PSA checked at 5 months, or it would have continued to grow another 7. My PET scan did not show metastasis, which is a great sign, but the odds of it being elsewhere are very high.
So if it spread, you call that it's left the gate.
The horse is out of the barn.
The horse is out of the barn. Right. So if you catch this early, and the reason we're making this video is because what you're going to hear next. I'm a little older than my friend here. At the end of the day, we're doing this for you because you don't feel, You don't feel
Nothing.
nothing. You don't feel nothing. But as I understand, you have that prostate cancers in your body, and it rests, and at some point it just germinates, right, and starts spreading. At some point, you get it at some point in your life, correct?
Very common. Number two cancer for males behind skin. So super common. Being in the medical field, I always told people, don't worry about it. It's nothing to worry about. Prostate cancer is not lethal. It grows very slowly. Most of us will die with it than from it. And until you get it, you can buy into that. But now, as I've done the research, it spreads, and once it spreads, the horse is out of the barn. The medical term is called metastasis. Once that happens, you have a lot more problems. I think with all cancers, and the women that are tuning in will know, the earlier you get breast cancer, the better chance you have of survival. And with all cancers, I think the earlier you get diagnosed, the better it is for you on an overall health plan.
So let me ask you this. So now you are faced with what to do next. Obviously, okay. And as I understand it, there's a couple options, but there's sometimes what you see or what you hear, much from what I now understand, is based on cost and who can make the money. But as I understand it, that's not necessarily the best thing. Is that correct?
Yeah, you have to be your own advocate on this, and things like YouTube, which we're watching now. That's how I did my research. My specialty is cardiology. Not much I don't know about that. Doing it 28 years, but urology was brand new, and initially we were treating that number, that 9 out of 10, and the recommendation was for surgery. The medical term again, radical prostatectomy. Pretty pretty barbaric
Would you please
procedure.
explain I didn't know this, it is barbaric,
Uh-huh.
but it's really important. And this scary part is what you must understand. Because if you get it early, and you're probably going to go to a doctor that this person's going to tell you, and he may tell you, the doctor, to do this. Why would he tell you? There's this involved. So what does that actually involve when you have this barbaric thing that you're talking about?
It's recommended from American Urologic Association or whatever, but surgery is kind of first line. Personally, I wanted to do sports medicine when I got out of school, and I never snipped a football field. I was in nursing homes and rehabs, and people don't break their hips from 8 to 5. So that's what got me into cardiology. But the one thing I did learn from my ortho experience is that surgeries last. Surgeries last. You don't rush to do neck surgery. Don't rush to do back surgery. There's a high probability that it's not going to work. That you're still going to have issues, and that's what I found with the prostate surgery. There was a very high chance that it's not going to work, and the side effects of the surgery were horrific.
What does the operation do? What do they actually
Remove
do?
the prostate robotically.
But what does that mean? What does that mean, remove the prostate? What's going on down there?
Cut it out.
Okay, what does that involve? When they cut it out, what other things are affected?
Well, look, on YouTube, it shows the procedure, which, thank God I took a look at before. The side effect, of that procedure, incontinence, impotence, wearing a diaper for the rest of my life at 65 when I'm perfectly well. I'm fine. I have no issues. And just the thought of that being a possibility led me to search for alternatives.
But what did they actually do physically?
There's 8 different holes. If you want to YouTube the Vinci robot, that's what it is. It's $20 million machine, good for certain types of surgery, and prostate is one of those. I just found that there were alternatives to that, and that's the path that I chose. I'm currently at the beginning part of the procedure for getting well, and if everything goes right with this triple therapy that I'm doing right now, I could be cured which is not the case. The radical prostatectomy does not cure you.
Why is it called radical? What is it so radical?
Watch the YouTube on what
No,
it
no,
is.
but I want people to know how bad this is.
Yeah, it's.
What do they do?
The urethra goes right through the middle of the prostate, so they cut the urethra at the top, they cut the urethra at the bottom, they pull down the bladder, they pull up the urethra, reattach it, put a Foley in there for 10 days. When they remove the Foley, hopefully you're able to stop your urine. Otherwise, you're in the diaper.
So you have an option right now to either have this procedure because insurance may pay, doctors and hospitals are getting $10,000, or you did your due diligence and found out what?
The majority of the time in an aggressive cancer that is a Gleason 9 out of 10, you're going to do radiation after anyway. So you're going to have a surgery which doesn't work and is followed by radiation. I did some research again on YouTube, not the way to find your medical, not the way to get your medical advice, but I did, and I found out so much information. I found an alternative treatment, and you got to make this decision yourself. That's the other thing I learned. I said you have to be your own advocate here, because the results of brachytherapy, radiation, androgen deprivation therapy, ADT, the results are the same. The outcomes are the same. The side effects so much less.
So you went ahead and said, I have to make this decision or go to brachytherapy. What is brachytherapy?
Everybody knows that it's seeds, and it's an old
I didn't
treatment.
know it was seeds.
Yeah.
So brachy, it must be a doctor brachy?
No. It's a type of therapy. I think it's the seeds. Brachy. I think it's the seeds.
Okay.
They're called that. But it's been around. My doctor has been doing it since '86, and the key is how many times have you done it? What experience do you have? It's all about experience. It's all about the placement of the seeds and the technique that the doctor uses. And the research I was doing on YouTube had two doctors from San Francisco, and they asked them, is there anybody else that you would recommend if someone can't get to San Francisco? And they said, only one guy, and it's my physician. Can I say his name?
Yeah, sure.
John Sylvester, and he's in the Tampa, Sarasota area.
But what is I'm hearing you have this Da Vinci machine.
Yep.
And brachytherapy and seeds.
Yep.
But for the person listening, what happens? Where do the seeds go? How does that all work out when someone's hearing this? What does that mean to them?
Radiation is a very good alternative to surgery for prostate. In my case, I made that decision. They're probably, 10,000 prostatectomies a day. It's very common. My buddy is an anesthesiologist up at Moffitt, and he said that the radical prostatectomy is the most popular surgery that they have there. And so the whole thing, I learned that medicine is business. It's not wrong. What they're talking about, it's not wrong. It's just, for me, it wasn't right.
But at the end of the day, you really got to look at these alternatives. Now, when you're having the surgery, I'm brachy, what are they actually doing to you? What are you going to walk through with brachy?
Well, my treatment plan is radiation, which radiates the pelvis, then the seeds, then probably 6, 9, 12 months of the ADT, the androgen deprivation.
Where do the seeds go? Who puts them in? Tell us about that.
Dr. Sylvester puts them in, which is why I'm staying with you. I drove 3.5 hours for this doctor specifically because of his training since '86. I asked him, how often do you do this? And he said every day. I had another at a center of excellence that I went to that said, well, I don't do them that often. I can do it if you insist, and that's not who you want doing it. You want someone that's done a lot of them.
So when you look at here, I'm just a lay person. I have a tax, as you guys know. I have a big YouTube for tax. But when I heard the story, and 83% of the people who watch these videos are men in this age range. So this so touched my heart that if only one of you goes to the
Absolutely.
doctor and has prostate cancer, and they want to say, "Hey, we have the Da Vinci." It could be possible. That's perfect for you, but understand, as he said, understand what he said. This is a business, and sometimes the radical. What was the Lord? The radical what?
Prostatectomy.
Prostatectomy. The radical. It's not like a tax form. Radical. So it's going to so rearrange your body that this brachytherapy may be the right thing. Now, I want to tell you something you need to understand from a personal perspective, because you go to your own doctor and your own doctor says, yes, it's Da Vinci. That does not mean that that's right, because that's only the doctor, what the doctor knows. That's in their bag of tricks. And if they send you to their best friend and that's what they're going to do, there may be a kickoff, a business decision. So what I'm hearing are two things. You need to go to that doctor who specializes in this robotic surgery, but if you were smart, you'd also go to the person who does brachytherapy, because I think at the end of the day, your whole body in the middle is not going to be changed around. You may have a better success rate, but do not just settle for what you're first told. Now, summing everything up, what would you think?
Be your own advocate. If you go to a surgeon, most likely going to recommend surgery. If you go to a radiologist, probably going to recommend radiology. And you got to make your own decision. There is no right or wrong. And we're clearly not a medical channel; it's a tax channel. But you have to make your own decision. And that's what I didn't realize. I didn't really get an option at the very beginning. If you have cancer, cut it out. And that with breast, with skin, with colon, that is the way to go. It's just there are other alternatives, and it's not voodoo medicine or eating some herbs. I mean, it's been around since 1986, and it does work. And what I saw was the results are the same. The results are the same.
Let's just talk about the financial aspect. So with these Da Vinci Road, it's not uncommon for the doctor, the practice, whatever the insurance, it's possible for them. And I don't know, we don't have the numbers. We think it's about a $10,000 range. But let me just tell you, to do this brachytherapy, generally, we're just making a general thing, but we're going to be close. How much money are we talking about doing this?
It's a inpatient procedure done by the physician in the OR at a hospital. It's $400.
And the doctor, these doctors are so committed. The doctor usually only makes about 20%. So by doing this doctor is going to make somewhere in the neighborhood of about $80 versus collect $10,000. You're not going to be rearranged. Now, we don't know about your case. I don't know crap other than that fact, IP. I know what's down there. I don't know anything about this, but I want to tell you, if you were going to sum everything up, it's due diligence. Or what else is it?
Look for alternatives. Get an opinion. And not an opinion from another surgeon. It's going to recommend. So I did that. I went to some centers of excellence. I mean, I work for a center of excellence, and I left them to seek alternative routes. Which, listen, you gotta. There is no right or wrong.
Marie,
there is no right or wrong.
Please go to the front door.
You have
Tell
to
them I'll
make a
be there in
decision
3
that
minutes.
you feel right about. And that's what I've done. And I'm a week into the radiation. I doubled up on my treatments so I can get a 6-week course done in 3. My doctor said, you're young and healthy. I want to get back to work. So yeah, I think this is the best way for me. And you have to decide what's best for you. That's the bottom line. There is no right or wrong, because the data will show that the outcomes are the same. It's just the side effect profile for me was significant. And that's what tipped the bar, toward my triple therapy. And that's why, because it's a 9 out of 10, I have to be very aggressive with this to make sure that it doesn't leave the barn.
Thank you very much for listening. If you contact me, I'll pass your information on to my viewer and one of my very best friends here. We don't want to share his name or anything right now. We want to see just sharing this information if it's important to anybody. I'd like him to get his own channel. That's something we're going to consider if we find that there's success here. his story has to go out to other people. It really does. So we'll see what the results are, and if he's going to start a channel, you can contact me. And I think what you received today, to be honest with you, is a great gift. We didn't have to make this video, but we thought we want to impart this knowledge on you, because if it just reaches one person, it's going to change your life. We make nothing from this. All we're doing is sharing. It's a basic testimony here, correct?
Yeah, I mean, if I can help one guy, then it's all worth it. When you get your physical, check your PSA, check it every year, even more frequently, but check it every year. And if you see a jump in the PSA, get on it. The earlier detection, the earlier you can treat it, and you have options.
Thank you very much for listening. If you want more of this or ever want to contact him, contact me, and I'll put him in. We'll see what grows from here. Thank you very much for listening. If any of you are going through this, you're going to go through a lot. I can tell you he has, but there is a light, a big light at the end of the tunnel. So anyway, stay tuned. Thank you very much for tuning in. I appreciate you for this special event. Thank you.